Hi guys, hi Facebook friends, how are you today? Today is our Botox event day. I have a lot of people that constantly talk to me and say, oh my God, Botox, that's so scary. Well, I've got my great patient here and our wonderful staff member, Jennifer, that volunteered to allow me to work on her. She's a makeup artist, so she does great things with her makeup, her eyes, but she's got a little bit of frowning, and I said, okay, let's get you started on Botox. Let's get you just baby steps to be comfortable with our procedure. How are you feeling?
I feel great.
Okay, so one of the problems patients usually will have with Botox is they're afraid that this is going to make them look very scary, paralyzed, distorted. And I always tell patients, you know what? Botox is just to help you start baby steps in relaxing those muscles that make you look a little bit angry, maybe a little bit frustrated in these centralized areas. So Botox is a botulism which I actually inject in small amounts into the muscles. It'll relax the nerve endings that then relax the muscles from working that create the wrinkles. So here's my first area. I'm going to start with her. So I want her to frown for me. See how strong her muscles are? If you can see that. You see them, Jennifer?
I have strong muscles.
She has strong muscles. So what I do is when I see a patient, usually I'll go in, I'll talk to them about areas of concern, areas that they really want to work on, just to relax and get rid of those little nice wrinkles. I then actually always make a graph for a patient. Everyone's individual. It's not a cookie cutter. It's not like 20 units here, 5 units here, 5 units here, standard. No. I like to meet my patients, have them take pictures before I even treat them. Then I make a map. The map will then tell you how many units I use per muscle. I've already mapped her out what I think is necessary for her and take it from there. I use a product that it is Botox made by Allergan. It is a product that I've been using for a long time, injecting for 9 years. I make sure that my Botox is official, and it became official a few years, more than a few years ago when you were having it sold in other countries. It has a kind of like a seal on it where you see it. It's a hologram on it, and you always want to make sure that's what you're getting. Botox that is officially from Allergan, that's what we use, we love, because I know that I can trust the product, I know how it's going to work, and I know how it's going to work on my patient, okay?
Miss Cynthia, we have a question.
Yes.
Samantha would like to know, how long do the results last when you get Botox?
Okay, so Botox lasts between 3 and 4 months. Your body will keep it for 3 or 4 months, you'll metabolize it, and then it'll be gone. So 2 things, if you've never had Botox before and it's the first time, it's kind of a nice way to try it. I'll do baby steps on you. If you love it, I know that in 3 months I'll see you again and we'll maintain it. Okay?
Awesome. How long does it take to kick in when you get it done?
Okay, perfect question. So people come in and say, okay, I want to have Botox because I'm going to a party tomorrow. Botox takes 3 days before it starts working. So I always tell my patients, okay, I'm going to inject you today, but remember, tomorrow you'll have the movement. The day after, the same thing. By the 3rd day, you'll start to see you have a little bit less movement, and then by 4th day, you know it's completely gone. I tell my patients all the time, I like to treat you, then I'd like to see you in 10 days. Because 10 days, I can actually see what I've done, what the muscles have done. If we need to tweak it at 10 days, I can always add more Botox and we can make it work better. After 14 days, if you come back and say, hey, maybe I need a little bit more, I'll usually tell you, let's wait till next 3 months from now. Now we know, we'll make a note and we'll add a little bit more. After 14 days, Botox then kind of really doesn't work for you. I'm almost as like your body kind of says, hey, you've already given me Botox. I'm kind of protecting from it. It won't kick in as well. And I don't want you to come in and spend your money and do more. I would rather you come and see me 10 days. We'll take it from there, and then 3 months again, we'll treat you. So I baby my patients. I use a little spray. You've always seen me. I use my spray for everything. So what I'm going to do is I'm going to spray her lightly right in her forehead where I've decided to inject her.
What does this spray do?
It actually just feels cold. Frown for me. So I'm just going to inject those nice little muscles that she has movement on.
She got me.
How do you feel?
I feel great.
Any
I
pain?
don't feel anything, no. It's nice and cooling and...
So don't forget to like, share,
Okay.
if you have any kind of comments. Tomorrow we'll be doing a drawing. So everybody that likes and shares our live stream or has a comment or a question will be entered into our drawing. We'll be able to do a live drawing tomorrow. And you can win yourself some Botox with Miss Cynthia.
You can use your $200 onto anything that you want for that day. All right, so I've treated in between her eyes, which is what Botox is indicated for. No bleeding. Little bit of the red bumps, they'll go away in 10-15 minutes. So if you come in your lunchtime, you go back to work, you'll be absolutely fine. You could put your makeup on. People ask me, are the needles big? I want to show you. It's a small little needle that I use, very little. Really doesn't hurt because it's small.
No.
And then I use a little bit of spray again. So I'm going to use a little bit of her crow's feet just for her little smile lines. Big smile for me.
And Miss Rodriguez is asking, does Botox help with headaches?
Yes, it does help with headaches. Some patients will come to me and ask me, through insurance, we don't do anything in our office. We basically use Botox as cosmetic. I will have patients that will do their Botox as cosmetic treatment, and it works for them. You want to inject this muscle up here that'll relax you, help you with your migraines. Some people, I'll also inject what we call the masseter muscles back here. If you bite down, they're really hard here. They get migraines because they bite down, so I'll inject them down here. It'll relax the muscle, help you with your headaches, and it'll also bring the jawline down really nice. So that's a little trick I do.
Is there any downtime on being asked?
No downtime. The only thing I request from my patients is when I do your Botox, I don't want you laying flat for the next 4 hours after I treat you. No exercising that night, and then the next day you go back to your normal activity. Smile for me.
So don't forget, our number here is 210-614-4320, San Antonio Cosmetic Surgery, board certified plastic surgeons, Dr. Ortegon and Dr. Baumholtz. This is our live stream every Wednesday at noon. Then on Thursday, we do a drawing for anybody that likes, shares, comments, asks questions. We will enter your name into a drawing. And you, with this live stream, you will get $200. Is that correct?
$200 towards any spa treatment. It could be our Botox, it could be our Juvederm, it could be our treatments with Amy, anything that you'd like. It'll be a $200 gift certificate towards our spa purchase. Anything.
Awesome.
So, again, Botox, 18 and above. Patients that have a little bit of movement, lots of movement, I'll actually come in, have you do an analysis with me. We'll talk about it. I'll show you what I've done before with before and after pictures. I'll show you my little map of what we can plan. We can always just discuss, hey Cynthia, I want to do a little bit of Botox, but I'm scared. We'll take baby steps. I'm not about trying to push a lot of the product in you. I just want you to get comfortable with it, okay?
And so what are the patients that are might not be candidates for this treatment? Is
Patients
there anything?
are probably that are on blood thinners. I would probably be concerned with patients that have allergies to certain medications. I'll go over your medical history. Patients that are maybe over the age of 65 where there's a lot of laxity in the skin, I might be of concern where maybe we have to kind of go into the consultation with my doctors, maybe a facelift, a brow lift, eyes. But like I said, we'll sit down and talk and do an analysis on you. And I'm pretty fair to patients, If it's not for you, I will tell you, listen, we need to take another step. The fillers are other things that work for some patients. As you know, we're going to have still our Juvederm, Voluma, all of our skincare, and, take that back. All of our filler products are going to be off, $200 off for each syringe. Our Botox is also on sale. Go to our Facebook page. You'll see it. Like us, comment.
Yes.
I'm here Monday through Friday, so I really enjoy. Next week, I'm going to do Voluma again. Patients have really been asking me about Voluma, doing more of the mid-face filler. So we'll be doing another live stream with Voluma next week. I'm really excited. Again, 614-4320 if you've had any questions. Facebook questions, great. Like us on Facebook, Dr. Delio Ortegon and Dr. Baumholtz.
Yes, ma'am. Okay, well,
we're also going to be having, before we go off, we're also going to be having a huge event on October the
19th from 5 to 8.
5 to 8 here in our office, kind of a patient appreciation. We'll have drawings, we'll have raffles, we'll have food, we'll have some live, also again, some live procedures we'll be doing so you can kind of have a little bit of a hands-on that you will see. Okay? Girls, I think we've done a great job again for this Wednesday. I want to thank everyone here today, our wonderful, wonderful patient and our staff member, Jennifer.
Yay.
The volunteers, not afraid of my little needles. Are you okay?
I feel great.
Yeah, and I'll have pictures of her after so you can see a little bit of, so now you see nothing. That's it, her beautiful face. No bumps, no bleeding, nothing. She did really well. And then I'll post her pictures afterwards so you can see the muscle movement that has relaxed.
And she can put her makeup on,
Yes,
right
ma'am.
back on. She can
Yes, she can.
cover those areas.
Yes, she
okay, San Antonio Cosmetic Surgery. 210-614-4320. We're located right next to SeaWorld off of 151.
Perfect.
Keep us in mind, friend us, share with all your friends, comment.
Thank you, Amy.
Thank
Our
you.
esthetician. Bye,
See you
guys.
soon.
See you tomorrow.
Bye.
Bye.